Hello and welcome to Epinephrine Administration for EMTs. I'm Tom Charlton, the Medical Director of several agencies in the area and Chair of the Protocol Committee for Southwest Ohio. First, we're going to start with an introduction. On January 1st, 2024, a new rule change went into effect at the state level. The State Scope of Practice Subcommittee added the administration of epinephrine intramuscular for anaphylaxis to the scope of practice with the board's permission. This allows EMTs to now draw medication out of a vial or an ampule and administer it for anaphylaxis. The intent of this was to reduce the cost of treatment of anaphylaxis as the cost of autoinjectors has risen significantly. This also should cut down on wasting of these expensive medications. To implement this change, the agency must have medical director approval, a protocol for administration, and appropriate training. Anaphylaxis and anaphylactic shock is the indication for epinephrine administration by an EMT. Anaphylaxis manifests in numerous ways. In order to qualify for the medication, you must have several symptoms or airway involvement. Patients with anaphylaxis may present with any of the listed symptoms on the slide. Many will experience hives, wheezing, rapid pulse, swelling of the face and tongue, and anxiety. When you encounter anaphylaxis, it is important to begin treatment quickly. It is also better to administer epinephrine than it is to withhold it. To administer epinephrine, you need to gather the correct equipment: an unexpired vial or ampule of epinephrine, a small syringe, a 25 to 27 gauge needle, 2 alcohol wipes, and a Band-Aid. If you are breaking an ampule of epinephrine, you will also need a filter needle. To draw up the epinephrine, make sure your hands are clean. Check the concentration and expiration date of the vial. Pop the plastic cover off of the vial and swab the rubber stopper with an alcohol swab. If using a breakable ampule, put the filter needle on the syringe. Carefully break the vial open and draw the medicine up with the filter needle, then discard the filter needle. You should draw up the milliliters listed in protocol, which typically will be 0.15 milliliters or 0.3 milliliters. Make sure to get the large bubbles of air out of the syringe prior to administration. Typically, epinephrine is administered into a large muscle body such as the thigh. Clean the injection site with an alcohol swab. Hold the syringe like a dart, 90 degrees to the skin. Quickly insert the needle into the skin. Depress the plunger to inject the medication. Dispose of the needle in a sharps container. Hold pressure over the injection site for a few minutes. Apply a Band-Aid if needed. If you have not already requested an ALS intercept, please do so. You may repeat the epinephrine dosing every 5 to 15 minutes as needed for continuing symptoms. You will shortly be shown how to perform this skill by your instructor. You will then demonstrate the skill back to your instructor. If you have any questions, please ask your instructor, an officer, your medical director, or email myself. Thank you for attending this training.